I wanted to share you one story when going back to our veterans courts and what type of discharges they take. So Judge Heath runs one of the honor court in Stark County. She's one of my favorite veteran court judges, been at it a long time. And they take every type of case. And they had a veteran in their court who had been dishonorably discharged during the Vietnam War. And his peer mentor dug into his background and found out that he had actually been wounded, had some serious PTSD issues, and in those days they discharged you when you had mental health issues as dishonorable, whereas now they really are try to be much more aggressive about that. So they worked on upgrading his discharge papers to an honorable, but in the process they discovered because of what he had done heroically during the Vietnam War, he was also entitled to a medal, and they were able to obtain a medal for him on top of the upgrade and present it to him in the Veterans Court. So that's the sort of thing that is just a great, great success story. So we're going to go ahead now to our next presenter, since we're moving along well, and this one is Relink. Relink is another one of these wonderful connecting resources. It's a very valuable tool. I think you will find it extremely useful. If you don't have answers on the website you've just seen, you can go to Relink, or Relink can find you resources that complement that. And so here to tell us about this is Barbara Campbell. She leads the Dalton Foundation International Healthcare Division. And under her leadership, relink.org has expanded from addiction recovery to a much broader-based county-wide community of care, or community-wide. It has now 19,000 services it connects Ohioans to, including housing, food, employment, mental health, etc. And special populations like veterans involved, justice-involved individuals, and veterans are given a lot of attention in this program. So we're very excited to have her present.
Good afternoon, everybody. It is just a privilege and honor to be here. Our foundation was founded by a very proud veteran, and I am very honored that my brother has been a lifetime in the military, and it has been the service that you all perform for our country is just amazing. So it's an honor for me to be here. Relink.org, as I said, it's a database. It's not always that exciting to talk about databases, but I'm going to do the best to make this interesting because we have seen how this is really helping people. And I will start from the very beginning. Relink.org is free. It's free to use. We are funded by private philanthropy and the state of Ohio, and we're very blessed in that way. So we want to keep it free. It'll always be free, and we just want to create awareness for people to use it. We got started back in 2017 surrounding the opioid epidemic, and it was around, for our foundation, it was a personal issue with a lot of family members struggling with substance use disorder, but also from a funding perspective for our foundation, we were being asked to fund various things around the state of Ohio, and the question always came up is what already exists? What facilities are already there? And so we were challenged to put together a database of what addiction recovery resources, what treatment beds were available throughout the state of Ohio. And we did that, and then we set up focus groups throughout the state, and I will say humbly that the site was terrible when we started. We put together the focus groups who told us that, and then we listened to what they had to say and maybe hired a new developer or two and made some changes reflecting what the people of Ohio wanted to see. And that was a continuum of care model. They said our focus on one topic, addiction recovery, was very limited, and everyone needed more help than just that. And their advice was really wise and has really made Relink.org grow into what it is today. Like I said, you can see that first picture. It is very awful, and it was very clunky and didn't work very well. And we've gotten a lot of feedback, and we've changed it. And one of our biggest changes, we started working with the Ohio Department of Rehabilitation and Corrections back in 2018. They saw one of our presentations and they're like, wow, this is fantastic for the reentry community if you can make some changes. So we sat down with them and our developers, and we really took a focus on reentry. And it was about at that same time when the topic of veterans came up, and where people were asking us, well, are you helping veterans at all? What are you doing for veterans? And we kind of were embarrassed, especially being veteran-founded, that we weren't. And so we quickly added that functionality to it as well, and I'll share that. But what we have now is 2 separate databases. So there's the public version, so you'll hear me referring to that as the public version. That's available to everybody, free of charge. Use it and search, and it's used by thousands of Ohioans every single week. And then the institution version, as I call it, this is the version that is on the tablets of every person that's incarcerated in the state of Ohio in the prison system. And that's a special version where all the links out have been taken out. So it's a safe version that went through years of testing to get to that point. But that launched in 2022 and has been a phenomenal success for us, working with the reentry population to develop reentry plans with a plan B and a plan C, so we can hope that people do not go back into incarceration. This slide has a lot of information on it that I'm just going to go through really quickly. We've got the broad categories of care of what kind of data you can find on relink.org, from the family services to the reentry. We do have legal services on there, which I'm not going to highlight today because, to be honest with you, we actually refer to Ohio Legal Help because it is such an amazing site. And then there's some other local resources in there as well. But all this type of information is on there. We do have a 24/7 hotline that I'll show you when I do the live demo. That is answered not by us, but a partner of ours that answers that with a nurse counselor that answers the phone. And these are our best target populations that we do serve, the justice-involved citizens. We do a lot with pregnant women, obviously the opioid use disorder veterans, and then the Spanish-speaking community as well. This here just explains, when we first started relink.org, the original intent was to help people find help if they were struggling with addiction, or maybe perhaps a family member, a mom or a dad wanting to find help for their child. We quickly learned, and again from the feedback groups, that these were probably not going to necessarily be our primary users because they are in crisis and can't always adapt to using a site like this, and also because hopefully a person struggling with addiction or their family member doesn't need to use relink.org every day. But what we did find is that the tool was very helpful for people like y'all who are in the position of helping people every day find help. So we found that social workers, we found it's used a lot in libraries. We found some of the court systems are using it. So we call everything in orange our professional users or our super users. And then our original target audience, with the exception of justice-involved citizens who use us a ton, use it actually a little bit less. So that was something we learned along the way, and it has helped us design the site with that in mind. I'm going to do a live demo in just a second, but just in case that live demo doesn't work, we've got these backup slides. But it's very easy to use. I can demo relink.org in like a minute if we need to. But the first thing you do is you enter your geography of where you're located, and you can do that by city, zip code, or you can do a county, and then if you're doing a city, you can also do a search radius off of that. The only exception to this is on the tablets, the institutional version that's in the prisons. They can only search by county, and that is for security reasons that are reasons I don't understand, but I was told that it had to be that way. And then we have our 8 buttons there of the different categories. A person will select a category. There's some subcategories that filter down from there, and you click on that, and then you start to get a list. And the list will go on, and then you click on an organization. So our goal has always been like 3 clicks, 3 seconds to find at least 3 options. That's been our kind of our mantra and our goal, and we do hope that that's happening in most cases for people to find resources. I'm I'm going to highlight this in the demo, but just wanted a special note for this particular. We do have filters at the top of each screen so that you can get a whole list, especially if you're doing like Franklin County. And if you want to filter it by what you're more interested in, the pregnancy filter and the veteran services filter are used a lot. So these would be services that cater to those populations or have some sort of expertise with those populations, so it can help with that. And then we do have Relink now available in Spanish, and we are working on some other languages based on the need and the demand. All right, so I'm going to go and demo this a little bit real quick for you. Hopefully. This is what the relink.org. Didn't click on my demo. Just pull it up real quick. Okay, so this is what the landing page will look on. You'll see over here that there is a box here for the 24-hour hotline. We do have that there for people that may be in a crisis, may need help. We do also list all kinds of hotlines on the site. So the first thing you do, like I said, you go in and enter your geography. I'm going to go ahead and put Franklin County in since we're in Franklin County. Go on the search class there. And then I'm going to just go through a few things real quick. The site is redundant too, by the way. This is another great feedback we got. Not everybody approaches a site like this with the same mindset. Like I might think differently than you think, but you can find categories under each thing. For example, housing being one of the most pressing issues right now. You can find housing under reentry, you can find housing under addiction recovery, you can find housing under human trafficking. So no matter what lens a person might be coming in, we hope we can guide you to the resources. And of course, housing's under basic needs too. So I'm gonna go under basic needs, and I wanted to show something under community support because it can highlight the veterans. So once you get, on a category. I did community support. So this has got a lot of organizations listed here. I'm not going to scroll down, but it goes down and down and down. And then we might want to filter by the veteran services, and then the list becomes a lot shorter, a little bit more manageable. And then if you clicked on an organization, then you see the information that comes up on that organization. It's got all their details. Of course, you can link out to it. It's got hours of operation if they have them. It has basically everything there in one place. I'm going to go back. I'm going to stay in basic needs for just a minute, and then I was going to show you some things under housing. We'll go under affordable housing, because we do have a lot here. We have all the halfway housing, of course, in there, and all kinds of addiction recovery housing and things like that in there as well. We do link out to different Ohio resources that can help as well. So that's why I give this example. Most of the affordable housing that is listed here is a lot of agencies that help people find affordable housing. We don't, I'll explain in a little bit how we do maintain this data, but we do not have the capacity to maintain the data on every Section 8 housing that's available in the state of Ohio, because that constantly changes. But this site right here, the Ohio Housing Locator, does. So people can click on there, they can find specific apartment listings or houses for rent in their area. And so we do have little things like this throughout the site, not just under housing. We have some other forms and other things that help people locate resources. And while we're here, I'll show you some of these other ways you can filter. You can filter by different organization types. You can filter by male and female services. You can filter by age if you're searching for a certain population. The payment option is for providers primarily providing addiction recovery services or behavioral health services, something that might require payment. So you can put that information in there. I'm going to show one more thing under basic needs real quick. Right now, food is a big topic. Food pantries have been our #1 searched item for the past 2.5 weeks. Not terribly surprising, but unfortunately so. And there's going to be a lot of food pantries listed here. One of the features that I love about relink.org is you can create a personal resource directory for somebody if they're sitting in front of you and they need some housing support and they need some food support and maybe they need some legal support. You can create a directory. So you can click these boxes over here on the left, and then you can scroll down to the bottom, and unfortunately, this is going to be a long scroll. As you can see, there's a lot of food pantries in Franklin County. But you scroll to the bottom, and then you can hit print. You can print it, or you can email it to somebody, and the information that prints out is the detailed information that's on the other page. So you could print out, you could click 5 or 6 of them, you can hit print, and you can hand it to somebody, and it's basically a directory. And it will print out the information that is on this screen. So they will get all that information with the hours and all the different services and phone number, and that will go to each person. I'm going to show a couple more options real quick. I'm going to go under the addiction recovery button because, again, this is kind of where we started. This is where we have the most detailed data. We do follow SAMHSA's guide for how they view addiction recovery services. And I want to point out one feature. We're under addiction recovery now, and I'm going to select some residential inpatient treatment. And you'll notice some bed icons appearing over here on the right. We do have basically hotel scheduling software kind of in here where it can track bed capacity. This is one place that is limited by organizations reporting their data. I'll explain in a minute how organizations can enter their own data. When I talk about how we maintain the data, I'll talk about this part of it. But we do have bed capacity data, and the way that the things, you'll see that Resolve Wellness has 10 open beds. The gray ones mean they have not reported to us in 7 days. We have no legal authority to make people report to us. I mean, nor do we want to, but it does help your organization if they do report bed capacity. This one here has 20 open beds, and if an organization is full, they can put in here that it's full. We've got it set up with all these organizations that they can literally update their bed capacity in less than 5 seconds, and it will go live the minute they do it. But still, individuals and organizations are busy, and it can be challenging to keep everybody updating their bed capacity, but the functionality is there. We did do a pilot project in Hamilton County, and we got a lot more of these to be red and green, which was great by creating that awareness that is possible. But that can help when you're referring people to know right away that there's open beds. And then I was going to show one last thing before we go back to the other part of the presentation, and that's under behavioral health. We have different treatment and counseling, and this is a good category that I think you can filter by veteran services. You can get a lot of counselors that can come up, and then you're able to use the filter to maybe find a smaller list of options that have experience in working with the veterans population. And all that data is there. So those are the categories I was going to demo. And then at the end, when we do questions, if there's anything else you want to see, like I said, we do have legal services in here as well, but since we had those other 2 great presentations, and I would be honest with you, we have a huge referral to Ohio Legal Help because their site is so wonderful. So I'm going to go back to this. All right, and then the next thing, the last part of the presentation, what I'm going to talk about is our data. And I'll be honest, we have so much data, I don't know what to do with it. Maybe someone out here can help me think of what we do with all of our data. So, and I think of data under 2 umbrellas for how we think. So there's the data of the organizations that are in the database. So organization ABC, what are their hours, what's their phone number, what's their website, has anything changed? And we have a staff member that is dedicated to that process exclusively. And then we have the data, the utilization data. Who's using Relink? Where are they using it? What counties? What are they searching? All that kind of data. And then we have a third type of data, which I'll talk about as I go through this. But so much data that we are kind of a little bit overwhelmed with it and trying to figure out exactly how to use it. I'll explain some of that as we go along. But I will say the number one question I get whenever I speak is, how do you maintain the data in the database? And we're always very humble. We are never going to have 100% of the organizations. Even as I'm meeting people today, I'm noticing, I don't know if they're in Relink, but we're going to find out, and we're going to get them in. But we do have that data people on our staff that are constantly updating the data. And so we have a kind of a multifaceted way we look at the data. So we can go on the back end and we can see, obviously, when an organization was last updated. So if an organization hasn't been updated for 9 or 12 months, that pops up in a queue for our staff to review that data and update it. We also have another list that comes up that is based on how many times an organization comes up in a search. So for example, if you were a big addiction treatment center that offers 17 different services, you might come up in 20 to 30,000 searches a month. Whereas if you are a small church food pantry that's open from Wednesday from noon to 2, you might show up, several hundred times a month in a search. So we as a staff want to make sure that we are updating the site that is getting the tens of thousands of views every month more often than the sites that are getting less views. And that's just because, obviously, if there's more eyeballs seeing it, we want to make sure it's accurate, and it allows us to be more efficient with the data updating process. And then in addition to that, we're always gathering information as our staff ourselves. We're always at community events, reaching out and learning more about what's happening around Ohio. But we've got a lot of partnerships at the state that are very helpful, that send us lists. They email or call us when something is getting shut down. It's been very, very helpful for us to get information really quickly, and so we're really thankful for those partnerships. And then we have a lot of utilization data of how many people are using Relink. We can look at what counties they're using it in. I did mention we have over 19,000 resources in the database for the state of Ohio, which is incredible. I will piggyback off of what other people were saying. I'm not from Ohio. I've been here 8 years now, but I am so impressed with this state, y'all. The amount of care and services, it's been overwhelming to me. So I think it's a blessing, and I would not be surprised if Ohio is the #1 state for veterans. If not now, they will be. I have no doubt. So we do have data for all 88 counties. We get asked that a lot because that's really important to us, that every county is represented. We're always looking for more resources in the rural counties. Unfortunately, sometimes there's not a lot of resources, but then that's also interesting data for us as well. But we've made about 3.5 million community resource connections in the past 24 months. And that's on both sites, both the public site and then also the institutional version that's within the prisons. That little chart shows us our growth. I think with any startup, you have those days where you're like, oh my gosh, what are we doing? And then all of a sudden you get some growth. So we are seeing that growth, and we're hoping to do some more enhancements to keep that growing. We've recently started collecting some veterans data. As in our work with the ODRC, they've been asking us some questions about it, so I pulled some data for them for one of their reports on what organizations are being searched the most under the veteran space, and those are listed here. But one of the most interesting things I found when I was pulling up the veterans data for them was we always do both sets of data. What's the public site showing and what's the institutional site showing? And the number of veteran searches coming out of the institution was over 5 times as high as on the public site, yet it's a much smaller population, numbers-wise, in the institution. So they're knowing that it's there and they're using it. We're trying to still understand all what this data means and what we're going to do about it, but part of it is this, where we're creating awareness on the public side that it does exist. So we don't have a huge advertising budget, so this is kind of how we do it, word of mouth, and of course it's free, but that's why maybe that slows us down a little bit, but that's how we've been doing it. This is just some more data. We can see like different court systems that are using relink.org. We're always very thrilled when we get the opportunity to do a Zoom with a court system to show how relink.org can help in that area. A lot of city governments use our site. And I think literally every university in the state has used our site. I can pull up the data, and it's extensive. A lot of high schools, counselors are using the site. A lot of libraries are using the site. And our number one user is the state of Ohio for our site. Pretty much number one, far in front. Another thing we've been doing, this data is a little old, so if you are up on this data, these numbers are probably better now, but this is a little old, but I just wanted to give an example of a project that we did where we can take, you can take overdose death rates and which counties have the highest overdose death rate per population. This slide also shows the ones that have the lowest, but you can see those geographies are circled there, and we're gonna focus on the bottom, the southern part of Ohio there. And then you can take the data that we have at relink.org. So we've got a report that we generate of how many treatment facilities are in each county, and then how many beds are in each county. So then we can take that data for those counties that had a high overdose rate and look to see how many treatment beds are there. And this is something that we share with funders and government to see where additional resources might be needed. Now, you could look at this data and interpret it in a few different ways, but it does help to sit down when you're thinking about investing resources or where should we invest, to decide where you want to do that, where the greatest need is, and where you'll probably have the most impact on lives. So we do a lot of different special projects for organizations on that. If anyone's interested in that, I'll be happy to talk about that more. This is just showing some of the partnerships we've developed over the years. We've done little projects and we've done big projects with a lot of different departments. We're very thankful to the state of Ohio for all their support and all the work that we've done with them. It's been wonderful. I don't know if many of you have heard of the Recovery Ohio overdose dashboard, but we're very proud to be a part of this with the state of Ohio. This is like a predictive analytic dashboard where they're able to actually predict where overdoses may occur based on zip codes, and the data behind it that's pulling up resource options to link people to help is pulled off of relink.org, and we're very excited and proud to be part of that project. And another thing we're very proud of was the Supreme Court of Ohio Task Force on Reentry. We got a small mention in there when they were talking about things that they thought would work and help in reducing recidivism. An increased awareness of resources was listed as one of those things, and it mentioned that using a database like relink.org could help with that. And so, again, we really appreciate that mention. That's helped us grow and expand the site. I also get asked a lot, like, oh, you've done a lot, what are you going to do next? And I'm not 100% sure. One of our biggest projects, though, we have seen such an impact in the reentry community. I'll be honest, we didn't see this coming when we first started the site, and we also didn't know exactly how it would uptake once it got onto the tablets in the prisons, but it's been incredible. It has been incredible, the amount of utilization and also the feedback we're getting. And so we really want to get in the county jails. I know not all counties in Ohio have tablets, but for those that do, that's one of our biggest focuses going forward. It's a little challenging in that we have to work with each county one by one versus working with the state at the state level and then rolling it out into all the prisons. But we think the impact on the reentry community is immense. And when you think of the jail population, it's a lot more transitory even than in the prison population. So we just want to make sure that everybody knows that this is available. And as I said many times, it's free. We don't charge for the software. It is a simple, we give you a link and you put it on the tablet, and that's it. Every tablet provider, though, wants to run their own security check on that. We know that, we understand that, and we're very willing to work with everybody on that. We have our staff that's out in the community. This is my, like I said, databases in general probably aren't that exciting, but hearing the stories from people of how it's helped them has really, I would say, surprised me. I mean, people had tears in the prisons come to us and say that they felt like they had control for the first time, or they felt that they could reach out to their spouse at home and help direct them to a food pantry because they can see the same thing in the institution that they can then share with their family on the outside. So it's just been really interesting and encouraging getting the feedback, and we just have thousands and thousands of comments on how relink.org has been helping people, and that is definitely what fuels us and what keeps us going to get it used into more and more people's hands. That was all I had to share, but I'm happy to take questions, and I'm also happy to demo anything else that someone wants to see. I didn't want to get into a really long demo unless there's anything people really want to see, but I'm very happy to do that.
Hey, Barbara, could you describe briefly how folks can contact you guys to get like a resource updated or added?
Yeah, oh, thank you. And I didn't actually talk about that. So let's talk about that. Thank you, Danny. I appreciate that. So we can be reached at the info@relink.org email is an excellent email. It literally goes to every one of our staff members, and we are committed to answering those within like 2 hours. So I know sometimes info@emails, you're like, does anybody even get this? We are very serious about our info@email. We all get it, and then somebody responds, and we all let the other person, everyone else know that we responded. So we're very good at responding to that email. But every provider, all 19,000 of those providers that are in the database that are running an organization throughout the state can go in and get their own account. So it's just like, I always make this distinction. If you are using relink.org, there's nothing to log in. You see I didn't log into anything. You just go in and you start searching. However, if you run a food pantry, or you run a treatment center, or you run a resource that's helping people reenter, and you're listed in the database, you can log in and get an account, and then you can go in. Once you're vetted, you meet with our staff, we get you vetted. Once you are vetted, then you can go in and update your own data. That's where that bed capacity updating in less than 5 seconds comes in. But you can also go in and then change your hours. Like we used to be open on Saturdays, but now we're not. And this is one of the great ways that this helps us keep the data updated as well, is by having everybody go in and update their data. So a lot of our staff time is spent training, and again, training takes 5 to 10 minutes on how to set up their own account and then update their own data. And that's extremely helpful on many levels.
Good afternoon. I just had a quick question back to the statement that you made in terms of not having this available in some of the county jails. Mm-hmm. Do you have, or have you considered, like a local community rep that could work with those said county officers or, the jailers to be able to establish this as a brand? This is a very useful system. I think I seen it when I was incarcerated. Although I didn't take advantage of it, I could imagine having that. I had vet court, but if I didn't, this would have been a system that I would have loved to have access to. What systems do you have in place, or have you considered for people who may want to get involved with getting the counties involved in this, which could ultimately reduce the recidivism factor?
Well, thank you for asking that question. We are always looking, that's one of the things we sit around. What is our strategy? How do we get into all 88 counties? Obviously, we're located up outside the Cleveland area. We can work a little bit better in those areas, but when it comes to the whole state, we need help. And I'm open to anybody who might be interested in helping us liaise and work with county jails, county court systems, things like that, to get the word out.
I had a question. You were talking about data, and you mentioned that you'd pulled some data from ODRC or whatnot. If a county just was interested in what different types of services or needs were being clicked on within their community, can you pull that? So
Yes.
at the prior presentation, they talked about statewide what the different categories were most popular. But if I'm a county, we talk a lot about collaborating so that there's not redundancy in services, but also being aware and informing our community partners of what's available. And so you being able to provide that data made to help demonstrate what needs are being not addressed, or at least being looked for in the county.
Yes, and that is exactly one of our projects we started in early 2025. We do now what's called county reports, or we can do a category report. I brought 2 samples with me up there. What we've been doing, like I brought a Franklin County report, and it's a summary of what resources, like by category. So, addiction recovery facilities, 280. I'm making up these numbers because I don't have the piece of paper in front of me. Food pantries, this many resources. So you can do an overview of how many resources are in each county, and we also do what is most being searched in that county. And then as we're working with a partner on those projects, we can narrow that down. Like I said, we have so much data. We can narrow that down to a specific area that you might be interested in seeing what's being searched. Like maybe you're interested in seeing our pregnancy centers being searched, or our adoption services being searched, or whatever category you might be interested in seeing what might be searched, we can pull that and look at that data. And then we're also able to do it by topic. So my staff right now is working on one for re-entry, broad level re-entry. What are we seeing searched the most? And then some subcategories under that. And we're also doing some where is it being searched? What counties, what areas of the state. A lot of times that where is it being searched data is not too surprising because it tends to congregate in Cleveland and Akron and Columbus and Cincinnati. But sometimes we do see some very interesting trends with that data. We've been doing another unique thing with the data. We do have a lot of human trafficking, anti-human trafficking resources on the site as well. And we can also see on a different way we might analyze our database, like what kind of hotels are using our site. And so we're doing a little project with that right now of trying to see if there's any searches in hotels that might be looking for human trafficking, to maybe look at where some human trafficking is happening, to then be able to hopefully stop that activity. So there's so much we can do with this data. I mean, I'd probably love to sit down with y'all if you have any ideas of what we can do with it to help solve some of the problems and challenges that we're seeing throughout the state. All right, and I'm happy to talk with anybody more about this. I'll be here for the rest of the day.
All right, let's get a round of applause.